After we have inspected, her respirations are good. I don't see that she has any cough. We're just gonna feel the chest. This, we're gonna look for like any crepitus, which is like that crackling noise underneath the skin. We're also gonna look for any pain or tenderness or swelling, and we're gonna go into the axilla. We're gonna do this on both sides, all the while watching the patient's face to see if there's any pain. Okay, and I didn't notice any crepitus, which is good. To percuss, we're gonna go ahead, you're gonna start above the clavicle where the apex of the lungs are. And here we're gonna hear, throughout the lung fields, we're gonna hear resonant sounds. If you hear dullness, it could be over like fatty tissue or like over visceral tissue. Okay, she's got good resonant sound. And then we're just gonna go down from that sternal notch to the angle of Louis, which gives us our second rib. And if we go down just a finger's breadth, that'll be the second intercostal space where we can start. And we're just gonna slide side to side. And we're just gonna move down a couple intercostal spaces. You wanna make sure to be careful over breast tissue because it can give you a false read. So just go ahead and lean back a little bit, kind of like laying on your, there we go. Lay on your arms. I'm just gonna do it down here a little bit. Okay, so we heard proper resonant sounds. I didn't hear any dullness, which is good. So we're gonna go ahead and auscultate. We're gonna use our diaphragm. And we're gonna make sure that there's like no adventitious breath sounds, that they're all clear. And we're gonna listen in the same spot. So we're gonna start above the clavicle and work our way down. So when I place my stethoscope on your skin, I just want you to go ahead and take a deep breath each time, okay? Okay, good. I didn't hear any adventitious breath sounds. They were all clear. Since we're working on the front, I'm also going to do the heart sounds while we're at it. So with the heart sounds, we're going to start, we use the 8-man mnemonic. It's aortic on the right sternal border in the second intercostal space. If we go right over to the other side, on the left side, it's that left sternal border intercostal space, also known as the pulmonic heart sounds. If you go down one intercostal space to the third, so let's see, down to the angle of Louis, so 2. If we go down one intercostal space to the third, that's our Erb's point that we're gonna listen to. If we go down 2 more, which is right here, it's still on that left sternal border. That's that tricuspid valve that we're gonna listen to. And then if we slide over midclavicular, right underneath her boob is the mitral valve, which is that midclavicular line, 5th intercostal space. We're also going to listen to the apical pulse here. And then we're also gonna make sure that it coincides with the carotid arteries. So with this, we're gonna wanna listen with the bell, just to make sure that we can't hear any murmurs. And then you can just breathe normally, okay? Oh, this little tag is gonna get in our way. Okay. And here we're going to also feel the carotid pulse up here. And for every beat that you hear, you should hear, or you should feel a pulse. You want to make sure that they're in sync. And they are. So I didn't hear any murmurs. which is good. The heart sounds were regular. They were at a normal rate, between 60 and 100. While we're on the subject of carotids, I'm going to use my bell again. I'm going to palpate both to make sure that we can feel them on both sides. She's got strong carotid pulses. You want to make sure not to do them both at the same time because you can make your patient faint. So I'm going to go ahead and listen. We're going to listen to 3 spots on each side. And what I'm going to tell my patient to do is I want you to take a deep breath in and let it out, and then hold until I get done. And I'll let you know when you can take another breath, okay? A good practice is to do this yourself so you know when your patient has to take a breath. Just take that deep breath and let it out and hold. Okay. Do on this side. Okay, good. Have you noticed any like numbness or tingling in your hands or feet? Any like excessive coldness on your hands or feet?
No.
Have you noticed any like blue tinged skin on your toes? No? Okay. With the carotids, I did not hear any bruise, which is a good thing. Like I said, they were a strong pulse, probably a +2. So we're gonna go ahead and I'm gonna do her pulses. So we're gonna start at the brachial. And these ones can be kind of tricky to find sometimes. You gotta move that bicep muscle. But you always wanna compare both sides. So if you can find them, you have pretty good ones. It's either like a +2 and steady and they're equal. So then we're gonna move down to the radial. These ones are easy to find. They're just on the side of that radial bone. These are strong +2, they're equal. We would normally do the femoral, but we're not gonna get that invasive today. We're gonna do the popliteal, and with these, sometimes it's a little hard to find because you gotta push it up against that tendon that's down there. So we're gonna see if I can do these both at the same time. Alright, so those are our +2, those are good. We're gonna move down to the ankles for the dorsalis pedis. Not the dorsalis pedis, the posterior tibial. Got a little bit ahead of myself there. Alright, so those are a good strong +2, they're equal. And then, so the dorsalis pedis runs along that tendon on the foot from the big toe. There we go. And those are a strong +2, and they're equal as well.
Sit back up for me. Next, we're going to move on to your chest and your lungs. Upon inspection, I'm going to note that the color is even throughout the rest of the body. The tan, I don't see any lesions, lumps, or edema. The temperature is warm, moisture is dry. And I'm going to go ahead and palpate, starting above the clavicle. Kind of go around, down. Let me know if you feel any pain or tenderness. Any pain or tenderness? No? Okay, so I would note that patient felt no pain or tenderness and there were no lumps or masses felt. Next, I am going to palpate the radial pulse as if I was counting respirations, and I'm going to note that it would be 12 to 20 beats per minute after listening for an entire minute, and that breath sounds were unlabored. And now I'm going to listen to your lung fields. I'm going to clean my stethoscope and listening with my diaphragm. I just want you to take a breath each time I move my stethoscope. Okay, go ahead and lift your arm up for me. I'm going to listen to your lateral fields. Breathe in and out. Great. Other arm. Okay, great. I would note that no adventitious sounds were heard, and breathing was unlabored and even. And if you'll turn around for me, I'm going to assess the posterior chest. So upon inspection, I'm going to note that the color is even throughout, and I don't see any lesions, lumps, no discoloration. The posterior chest is symmetrical with an elliptical shape. Or the anterior chest has an elliptical shape, but the posterior chest has that symmetric downward shape of the ribs. So I'm going to go ahead and clean my stethoscope again, and I'm going to listen to your lung fields. Okay, just breathe in and out each time I move the stethoscope. Okay, great. I would note that there were no adventitious sounds and the lung fields are clear. And now I'm going to percuss at the costovertebral angle at the 12th rib. Just let me know if you feel any pain or tenderness. Any pain or tenderness? No. Okay, great. So I would note that no pain or tenderness felt at the costovertebral angle. You can go ahead and turn back around for me. Now we're going to move on to your heart. And I'm going to go ahead and percuss at the apex, the base, the left sternal border, and I'm going to note that I didn't see a heave or feel a throw. And I'm going to go ahead and clean my stethoscope again. And I'm going to listen to the apical impulse in the 5th intercostal space, medial to the midclavicular line. And I'm going to listen for an entire minute, and I would hear 60 to 100 beats per minute, and I heard a short, gentle tap. Now I'm going to listen to the rest of your areas of your heart. So I'm going to clean my stethoscope again, and I'm going to start at the aortic area in the 2nd intercostal space to the right. And then right across to the left in the 2nd intercostal space, the pulmonic. And in the 3rd intercostal space underneath on the left, Erb's point. And then in the 5th intercostal space, the tricuspid area to the left of the sternal border. And then the mitral area, 5th intercostal space, medial to the midclavicular line. And I'm going to go ahead and do that again with my bell. So aortic, pulmonic, Erb's point, tricuspid, and mitral. And I'm going to note that the rate and rhythm of the sounds were regular with no sinus arrhythmia and no pulse deficient. And I would note that S1 was heard louder at the apex and S2 was heard louder at the base. Next, can you lay on your left side for me? So I'm going to listen at the apex with my bell. And I'm going to be listening at the 5th intercostal space, medial to the midclavicular line. And I'm going to note that I heard no S3 or S4 extra heart sounds. And you can go ahead and sit back up for me. And I'm going to have you just lean in a little bit like this. And then listening with my stethoscope, listening with my diaphragm. Just breathe in and out for me. Okay, so no diastolic murmur was heard.
Farthest away over here.
Do you have a history of smoking?
No. Inside over here. Farthest away over here.
I'm gonna listen
Inside
to your
over here.
lungs really quick. So when I put this on your chest, just take a nice deep breath for me.
Inspection, I looked before, there's no edema, no intraocular refill
Bronchial.
was less than 3 seconds, no signs of
Bronchovesicular,
no excess sweating, skin is pink and
vesicular lung sounds. Okay, we're gonna down this back too.
fluid, blood, bronchial, vesicular, and vesicular longulus.
Normal lung sounds heard throughout, no adventitious sounds, no crackles, wheezing, or anything like that. Your breathing pattern is even and regular. So can you sit up nice and straight for me and take a nice deep breath? Good. So excursion is symmetrical. And I'm gonna put my hands on your chest, just say 99.
99, 99, 99, 99,
Okay, and on the back.
99, 99, 99, 99.
Okay. Tactile firmness is equal bilaterally. I'm gonna do some percussion on your chest.
Like I got all the normal heart sounds, but at all points, no murmurs, no heart sounds. Vesicular and heart palpitations or heart flutters. Is your temple pulses?
Okay. Resonance heard in all fields. Do you have any shortness of breath, difficulty breathing anytime? We do cardiac now, so just gonna listen to your heart really quick. Mind laying down for me, actually?
Pulses are even.
Your aortic.
Like I said, it's saying good night.
Inspection, you said you don't have any trouble chewing or swallowing? Any indigestion?
Nope.
Changes in diet or fluid intake?
Point.
Any unintentional weight gain or loss? Diarrhea or constipation?
Last year, he came in.
Right. Abdomen is symmetrical.
Just gonna lift up your shirt.
Foreshadowing. I'm going to also
This is
take
your
out
tricuspid.
at the right lower quadrant.
Mitral. Good. S1 and S2 sounds were heard. No abnormal sounds were noted. I'm just gonna feel your pulses now. Wait, so you want your temporal?
Yeah. I could really hear that one. Man, what is up with
Carotid pulse. Your apical pulse.
Bowel sounds are active, maybe a little bit hyperactive.
Oh, sorry, yeah.
And then if you don't mind, can
Of
I
course. Mhm.
listen to your heart sounds?
Sure.
So I'm going to listen to your heart sounds. I'm going to use the pulmonary, the aortic, and then there's also the mitral and the tricuspid. I'm just going to do that real quick. Okay, and then I'm going to check the apical portion and count her apical pulse for a full minute. Okay. And then, let's see. I'm also going to listen to your lung sounds. Is that okay?
Oh, yeah.
So there's 6 on the front and 6 in the back, anterior and posterior. Okay, so I want you to take a deep breath for me. And these are just the lower lobes. Okay. And then I'll do her back. Take a deep breath for me. Okay, so no adventitious sounds, lung sounds normal. And then I'm also going to check your kidney tenderness. I want you to let me know if you experience any pain or tenderness. All good? Okay, excellent. And I also want to check, can I check your hands real quick? So I'm going to check her cap refill, which is excellent, less than about 2 seconds. And then her turgor, her skin turgor, which is good, it's supple, and as well as your pulses. So I checked your apical pulse, and then I'll check your wrist pulses, and I'll check both of them. And then I will check your carotid pulses as well, if that's okay. I'm only going to do one at a time. And then I also want to listen for any bruits with my stethoscope. And I'll use the bell side. And take a deep breath and out.
His posterior chest, so I'll step over here so I can see his back, okay? So I'm gonna always start with inspection. So I'm just inspecting his skin on his back and looking at the shape of his chest from the back. I don't see any obvious barrel chest. I don't see anything on his skin like a laceration or a wound that would indicate recent trauma. And I don't see any use of accessory muscles here in the back. So what I'm gonna do next is percuss, or actually first I'll palpate for tactile firmitis, and then I'll palpate also for thoracic expansion, and then I'll percuss. So I'm gonna look at his thoracic expansion first to measure his AP diameter. So I'm gonna place my hands right underneath his ribs here. Sorry, my hands are a little cold, Kelly. And I'll have you take a deep breath in and out. Great. So when watching my thumbs expand, I can measure how deep his breaths are to measure his AP diameter. And his was about 4 centimeters, which is average for an adult male. So that's great. Next, we'll palpate for tactile firmitis. So this is where I place my hands on his chest and I'm feeling for vibrations. So he's gonna say 99 as I feel for vibrations, and I'm feeling for any increased vibrations than normal that could indicate consolidation like a pneumonia. Okay, so I'm gonna palpate and go ahead and say 99.
99,
Again,
99,
again,
99,
one more time.
99.
Great, so I didn't notice any increased tactile firmitis from what I would normally feel. Next, we'll percuss different regions of his chest to feel and listen for tympany versus dullness. Dullness, again, could indicate consolidation with pneumonia, okay? Great, that's fantastic. I just heard tympany throughout, no areas of dullness noted. So I'm gonna listen now and auscultate the various lobes on his posterior chest and listen for any adventitious lung sounds, okay? I'm gonna use the diaphragm of my stethoscope. So just take a deep breath. And again. Great, his lungs sounded clear to all lobes bilaterally. I didn't hear any wheezes, rhonchi, rales, nothing like that. So I'm actually gonna have you, Kelly, come sit over here so I can listen to the front of your chest. So again, since this is my first time looking really at the front of his chest, I'm just inspecting, again, for any retractions, signs of respiratory distress. Sometimes you can see them subcostally or intercostally. I don't see any, and again, I don't see a barrel chest or tripod positioning that would indicate respiratory distress. So I'm gonna go ahead and auscultate all of these lobes in your interior chest. Take a deep breath. Great, so again, lung sounds were clear and equal bilaterally to all lobes. So that sounds great. What I'll have you do next is actually lay down here. Great. And what I'm gonna first do is I'm inspecting his cardiac silhouette. So I'm gonna sit down and I'm looking for any heaves, lifts, or thrills, anything like that, which I don't see. Then I'll go ahead and palpate, trying to find the point of maximal impulse or his apical impulse here. So I'll go ahead and palpate. It's usually on the left side of the chest, close to the midclavicular line. So I'm going to go ahead and palpate, trying to find that apical pulse. There it is. Good. Okay. So I'm going to go ahead and listen to his heart, and I'm going to listen at 5 different areas. So the aortic valve at the second intercostal space on the right sternal border, the pulmonic valve on the left sternal border at the second intercostal space, Erb's point right below that, the tricuspid valve, and then the mitral valve. Okay, I'm gonna listen first with my diaphragm, listening for S1, S2, and then any extra sounds like clicks or gallops. And then I'm gonna listen with the bell of my stethoscope again to hear for any murmurs, okay? So second intercostal space, right sternal border. It's my aortic. Second intercostal space, left sternal border is my pulmonic valve. Erb's point. And tricuspid valve. And then moving outward to my mitral valve. Great. Listen again with the bell. Great. S1 and S2 were audible. I didn't hear any extra sounds or gallops, and no murmurs were detected. So the next thing I'm going to do is palpate his carotid pulse, and then I'm going to auscultate for any bruits. Anytime I'm palpating the carotid pulse, I'll just do one side at a time, okay? So we're going to start over here. 2+, excellent. Right here. Great, 2+. And again, I'll listen with the bell of my stethoscope.
Okay, next what I'm going to do is I'm going to be checking your anterior chest. I'm going to be going over your heart sounds. After that, I'm going to do your lung sounds. Only thing I need you to do is just breathe normal while I do this. My next direction will be for you to breathe in and out every time I place my stethoscope, but not right now.
Okay.
Can you lift up for me? Perfect. And I'm gonna check right here. Okay, awesome. Next thing I'm gonna do is change my bell around, and I'm gonna go back through the same order, okay?
Okay.
And do you mind lifting up for me again?
Oh yeah, of course.
Let me check right here. Okay, awesome. The next thing I'm going to be checking for is your lung sounds again. Once I place my stethoscope, I want you to take deep breath in and deep breath out every time.
Okay.
I'm sorry.
No, you're good.
And can you lift up?
Mm-hmm.
Okay, awesome. Next, what I'm going to do is I'm going to be checking your posterior.
Okay.
Just sit right there for me. I'm just move your hair here. I'm going to check your spine first. Make sure no curvature or anything. And we're checking for your scapula. Replacement. Take a deep breath for me. Okay, I'm gonna be listening with my stethoscope for your breath sounds again. If you'll just take a deep breath in and out. thought I'm gonna have you do now. I gotta check one thing on it, okay? Breathe in.
All right, the first thing I'm gonna do is I just wanna look at your general respiratory effort. See if you're using any accessory muscles. Okay, just take some breaths for me. Look at the symmetry. Okay, and that looks great. Okay, the next thing I do, could you slide your knees around that way and just sort of face along? I'm gonna check your chest expansion. Is it okay if I just fold your shirt up a little bit so I can feel? Okay.
Hold hands.
Too.
Not
Sorry.
too bad. No, no.
Okay, take a nice deep breath. One more. All right, good job. You have nice, good chest expansion. All right, the next thing I'm gonna do is I'm gonna percuss. Try to get underneath your shirt. Could you cross your arms for me? There you go. Try to get in between the ribs. Okay, just gonna go under your shirt. Let's see. Tuck this in here. And I'm going to listen to the sides as well. Okay. One more. All right. The next thing I'm going to do is I'm going to listen. So could, with your mouth open, when you feel my stethoscope touch your back, could you take just a deep breath for me, please? Yes. Good. Good job. Right, now I'm going to listen to the sides. Another. All right, great. Everything sounds good. All right, the next thing I'm going to do, I'm going to put my hands under your shirt. When you feel my hands touch your back, will you say toy boat for me, please?
Toy boat, toy boat, toy boat, toy boat.
Good job. All right. The next thing I'm going to do is I'm going to do the front of your chest. I'm going to turn around and put your knees forward. Okay. Okay, the first thing I'm going to do is I'm going to percuss. Between the ribs. All right, I'm going to have to go up, okay? Can you hold it maybe there with your arms? Okay, there we go. Let me get between the ribs here. Alright, let me go. I should be going across here. Let me try that again. Alright. Should do one more. Just down here. Alright. Now I'm gonna listen. please. Mouth open. All right, one more. Doing a great job. Okay, good job. And then finally, okay, that concludes the respiratory portion. Now I'm going to do a cardiac exam, okay? While you're sitting up, could I just have you lean a little, even if that's better, sorry. Could I just have you lean forward just a little bit? Find your angle of Louis. Come over. I think that's about right. Take it, exhale fully, then hold it. Okay, evaluating your aortic valve, and it sounds great. Okay, now I need you to lay flat. Well, I'm going to put you at 30 degrees, okay? There you go. Give it a little down. All right, the first thing I'm going to do is I'm going to palpate. No, the first thing I'm going to do is I'm going to look at your carotids. I don't hear any breweries. And I'm going to feel. I don't feel any thrills. Good strong close. Okay, I'm going to come over to the other side. It's more comfortable there. Alright, the next thing I'm going to do is I'm going to feel your cardiac landmarks. I'm going to feel your aortic valve in. I can't fit. I'm going to go on your shirt. I'm going to put my hand here. Sorry about this. Close and personal. See if I can feel. Okay, good job. The next thing I'm going to do is I'm going to listen. Can I fold your blocks up a little? Just make it like yours. Okay. Now I'm going to listen to your heart. I'm going to turn it to the bell. Listen to your tract acid. Okay, could I have you just turn slightly to your right? Okay, good job. Okay, that concludes the
listen to your heart first. Okay. You didn't have to breathe any special way, just breathe normally.
Okay.
And I will be just listening. Okay, I'm gonna test. I'm gonna be listening to heart sounds in an abdomen mnemotic, meaning I'm gonna go for the second intercostal space, just right of the sternal marker. Okay, so that's my first placement, and I'm gonna be listening to the apical. The aortic area. I'm hearing S1, S2, no adventitious sounds, no murmurs, no clicks. I'm going to come over here and I'm going to go down 2 spots to the second intercostal space on the right side. And I'm listening to the pulmonic area here. And I'm hearing S2 louder than S1, which is normal. And then I'll pop down to Erb's point. Notice I'm always feeling where I'm placing the stethoscope. Heart rate, not rate, but heart sounds are nice and strong. Again, S1, S2. And then I'm down in the tricuspid area here. And now we're starting to hear S1 louder than S2. I'm actually going to try to feel the PMI, which is the point of maximal impulse. Here's his clavicle here, and I'm looking at mid-clavicular line, 5th intercostal space. So that's here. I'm going to try to palpate that. And I can feel it really easily. So I'm going to always put my stethoscope right over that PMI for the mitral area. Again, nice strong heart rate, S1, S2, no adventitious sounds. So I'm going to turn the stethoscope around and now go with the bell because I'm listening for lower pitch sounds and murmurs that I might not have heard the first time. I'm always kind of palpating to make sure that I'm in an intercostal space. Erb's point there, pulmonic area here, and back to my apical area. So when I'm listening to heart sounds, again, I'm listening for my S1, S2, and then noting if there's any adventitious sounds, and that's how you would chart it, S1, S2. I could also gather an apical heart rate at that point. Didn't feel like I needed to. Okay, now I'm going to move to listening to your lungs. So I've already kind of asked you the question, so I'm going to move right into the auscultation piece. I'm going to pop my stethoscope back over to the diaphragm because lungs tend to be more of a high-pitched sound. Okay, can you pull your gown down again? Down to kind of more your belly button. Okay, so lung fields are really not going to go much lower than my ribs here. So what I'm going to do is I'm going to place the stethoscope on your skin, and when I do that, I want you to take a deep breath in and out. And then I'll place it in another spot, and you'll take a deep breath in and out. Let me know if you want to stop at any time if you need to take a break.
All right.
Okay? Okay, you can lift your gown back up. So I heard nice and strong bronchial sounds up near the top, the kind of anterior lung fields, and then more bronchovesicular sounds mid-range, and then down in the base is more vesicular sounds. So it's kind of that upper, more high-pitched sounds here, mid, and then lower pitched sounds. Breeze, it was nice and breezy. There was no adventitious sounds, no wheezes, no rhonchi, no stridor, nothing like that, no crackles. Okay, so I've kind of hit the front anterior lung sounds, but I definitely want to hear from the back because, as you know, you can hit different lobes easily more in different areas. I want you to take note of the scapula here, okay? So you have the vertebra here, and then the scapula here. And then you have this nice prime area right here where his muscles are, and that's where you want to place the stethoscope for your lung auscultation, because you're never going to hear any lung sounds over a scapula or over the vertebra, okay? And then don't forget the axilla area and down on that lateral side. So same thing, I'm going to have you take a deep breath in and out when I place the stethoscope.
All right.
Notice I'm not moving the stethoscope until he's completely done with exhalation. Sometimes I see nursing students moving that stethoscope before they're actually done with the whole exhalation, and you might miss some adventitious sounds if you do that. Again, I'm hearing nice and breezy sounds, vesicular sounds down here, no adventitious sounds. Let's just do 2 more. One over here. And 1 more. Great job. You doing okay?
Yeah.
Okay.
To listen to your carotid arteries. First, I'm going to palpate one at a time. Good. 2 plus. Good. No worries noted. Everything sounds good. Next, I'm going to move on to your heart. Can you lay back on that pillow for me? Oh. I'm going to pull it up underneath you. Turn your head to the left. I'm looking for jugular vein distension. And that is, she has no jugular vein distension, which is good. You can sit back up for me. I'm going to listen to your heart sounds. Do you have any heart problems? Any history of congestive heart failure? Okay. I'm going to lift your shirt up real quick. Good. I'm going to palpate the point of maximum impulse, which is the mid-clavicular line, 5th intercostal space. Good. No deviation noted. Next, I'm going to assess the lungs. So I'm going to listen to the lungs. Chest is symmetrical. No abnormalities noted on the chest. She has normal expansion, normal respiratory rate, which I assessed in the beginning. Deep breath. Good. I'm going to assess the lungs on each side. And then on the other side. Good. Can you stand up and turn around for me so I can listen to the back? Perfect.
Do you need my shirt up or?
That's fine. Deep breath. Good. I'm going to assess tactile fremitus, so I'm going to need you to say 99 when I put my hands on your back.
99. 99. 99. 99.
And then I'm going to assess for chest expansion. And good, that is normal. You can put your shirt up, perfect. And then if you'll turn around for me. So chest is normal, lungs sound good and clear in all lobes, anterior and posterior. Next I'm just gonna go ahead and take a listen to your heart. Using the diaphragm and the stethoscope, I'm gonna go to the 2nd intercostal space. This is the aortic area. S2 sounds are heard loudest here. Going over to the left side, this is the pulmonic area. S2 sounds are still heard louder here. Going down one spot to Erb's point. This is where I would hear any signs of murmurs. Going to the 4th intercostal space, this is the tricuspid area. S1 sounds are heard loudest here.
and this is the mitral area. S1 sounds are loudest here. I would also listen here for 60 seconds for the apical pulse, and then I would use the bell of my stethoscope and go back up the same way that I came. All right, now I'm gonna listen to your breath sounds.
Okay.
Just breathe in deeply and then exhale deeply as well, okay? Each time I move the stethoscope. All right, second intercostal space. Okay. All right. Okay, you can breathe normally now, okay? Okay, just have you displace your breast for me and all right, now we're gonna move to the back. And listen as well on the back. Can you breathe in normally for me? I mean, deeply for me, please. Thank you. You can breathe normally now. And one more time. All right. There are no adventition sounds like